Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I am joined by Julie Sturgess from country to coast Queensland. G'day, Julie. How are you?
I'm fantastic, Peter. Thank you for having me.
I know you are, and it's great to have you on the podcast, and I've been looking forward to this conversation, and we had to remind ourselves to actually press record because we had a good chat prior to actually having this conversation. So looking forward to really diving into understanding a little bit more about CCQ Queensland and the region in particular, but also really getting to unpack a bit more about this point around giving access to better healthcare and equity for people, particularly in regional and other parts of Australia that might be tricky to access that. So firstly, for those unfamiliar, would you be able to please provide a bit of an introduction about you and particularly CCQ?
Sure. Country to Coast Queensland delivers the Primary Health Network program, obviously, and you're right, a really diverse region. So Central Queensland has very remote areas with virtually no service provision, and Wide Bay similarly less. And we also have the Sunshine Coast area in there, which is a very populous and outer metro region, really. And so the challenges that we face in delivering care can be really quite different. I think as an organisation, though, we've got a commitment to making sure that anyone in our region can access that. And what we've actually found in a lot of the work we've done is that rather than just concentrating on those rural and regional places, in actual fact is the partnership between the Sunshine Coast as an outer metro and those regional and rural services that actually allows us to increase service provision and access across the board. So, rather than just focusing on rural solutions, it's really focusing on the solutions and the partnerships we need between those three very diverse areas that actually helps us achieve the outcomes that we're looking for. So, I often say, people say it's a big region, and it is. We spend a lot of time on the road just connecting with people and understanding what the issues are. But our philosophy is that it would be very hard to do it in a really positive way unless we had all of those diverse regions to be able to conquer the problem together.
Yeah, I mean, that creates, that's what's great about the region is the diversity and the breadth. But you're right, in terms of being able to, manage it as a particular cohort. This is the type of people that live here, and this is the challenges they have. You can't really hone in on a particular, because as soon as you focus on this particular issue, then you've got your own little, the rest of it tying in together. And I feel like this represents a lot of parts of Australia and other parts of the world too. So there's a lot that we can unpack there, because they're the challenges that we talk about a lot. When I think about healthcare and the issues we need to address, equity often comes up as a big one. So I'd love to hear from you about how you approach that challenge of that, the diversity of the region and what even that means to you, because we throw it around a lot in terms of equity of healthcare. What does that mean, and particularly to CCQ?
It's such a good question, and I should fit in here a plug for our Equity Summit that's coming up in October as well. So at CCQ, we host a group called the Equity CoLab, and it's about how we bring people together to focus on how we actually drive equity as a central part of practice, not just in healthcare, but actually everything. Because I think from our point of view, a lot of people talk about health equity and they associate that with equitable access or those sort of things. But the reality is that health equity is almost an outcome of equity. It's almost something that you achieve because you have equity, and equity is not just a health service. It is, all the other social determinants that actually come together. So as an organisation, we're very focused on, obviously the things that we need to deliver for the Commonwealth in the PHN program, but also really recognising that, the vast majority of health outcomes are achieved by providers and solutions and initiatives that sit outside the health sphere. And so we work really hard, first of all, to look at our data, not only in the health space, but actually much more broadly, because, we actually focus on the sustainable development goals that the UN actually propose around how we get good outcomes and how people live purposeful, healthy, productive lives. And, health impacts on many of those measures, but also all of those measures impact on health. So, we're doing a lot of work at the moment around not just looking at health data, but overlaying all of those social determinants data, also overlying a lot of other data, so that we actually start to get a picture of actually what are the things that come together to help us understand what helps people live their best lives. Incredibly interesting, some of the things that we're seeing. And to your point, particularly looking at the clusters of groups that we have in our region, when we look at the national data, we see that those clusters we share, particularly a lot based on geography and the sort of people that live in those areas. There are clusters in other parts of the country that are actually sharing the same problems as we are. So we're really excited about how we start to use data, but also overlaying now AI and machine learning to actually start to do some forecasting about, well, hang on, if we really want to change outcomes here, how do we start to use some predictive technology to actually start to go, well, what are the things that are going to make the biggest difference to health outcomes, but actually to a lot of others? And certainly in some of that predictive work that we're doing at the moment, it probably wouldn't surprise a lot of people to know that a lot of the things that we need to influence are much higher up the food chain than, intense acute health services. They're, all of those things that impact, the beginning years of life, or even, the pre-birth part of life, to make sure that people achieve the best outcomes. So I think, looking at data appropriately is really important. We start to see we share a lot of commonality and not as many differences as we thought. But also, for us, it means we start to leverage the relationships with other communities like ours, so that we can start to come together in a robust way, looking at data to think about how we can solve some of those issues.
Yeah, got you. Interesting. And as you're talking, I'm thinking from my own experience of, I guess, as CCQ, as a primary health network, as a PHN, and in my dealings years ago with PHNs, I learned that just because one PHN is over here does not mean that it's the same as this PHN over here. It's an interesting model in Australia. For those that are unfamiliar with the PHN model, on the Talking HealthTech website, we've got a comprehensive glossary, and we've done a few episodes on what PHNs are. But I would actually like, we could be able to provide some context in your response too, Julie, because I think about how primary health has evolved over the years, and that would obviously then impact like what PHNs should be doing, need to do, and have prioritized things. How do you think about how the PHN model has kind of shifted over time, and what's become super important in your role in being that kind of, because I always think sometimes they're like the wrangler of stuff, or the if you need this, then you go over here, and some are super hands-on, and others can be quite distant. So would love to get your thoughts on what that means.
Look, there is no doubt it has evolved over time. And, the very point of the PHN program is it actually understands the regional needs of the communities that you're dealing with. So I think that's a real strength. And in our mind at Country to Coast, we are, very closely connected to our communities. And particularly we have community at the centre of all of the work that we deliver. So, we are lucky to have, those funding streams from the Commonwealth to deal with those issues. But the way we develop the solutions to that in every PHN, I would warrant, is a little different based on the co-design and the work that they do with communities. Certainly in this one, our focus is on community-led design and delivery of programs, and you would see that through all of the work we do. We are just implementing right now a great piece of work that we got funding from the National Emergency Management Agency for, around community-driven resilience in the face of disasters. And, when you look across the whole country, climate change and its impact through disasters is one of the biggest risks we're facing as a country. And certainly in our region, we have our fair share of, those sort of things to deal with. And so the whole focus on that is actually bringing communities together and bringing all the agencies that work together and community designing the way that they're going to build their resilience and preparedness for disaster. And, the evidence would show us that when a community owns that future, their ability not only to deal with the initial disaster, but to recover is much higher. And certainly, we see the risks increase with subsequent disasters. And, they're the sort of things we're facing right now. So the answer really is about building that resilience. So there wouldn't be a program that we do in this PHN that does not have that community-driven focus to design the solutions. But, the first thing we do with community is work with them to actually understand what the problem really is. As health services and health service providers, there are no end of examples of people throwing solutions at a problem that they don't always understand. And so, we work really strongly to actually collect all of that baseline data so we actually understand the problem, and then community have the literacy to understand the problem as well and design it. So, data is a critical part of what we do, with that resilient communities work. It has a lot of data to understand what the issues are. We've got some other homelessness projects on at the moment. Incredibly, homelessness is just increasing everywhere, but certainly in our PHN. And, so we're implementing across the region ways to actually collect data so that everyone working in that space can understand the role of everyone else, but really understand the issues that are causing people to be homeless and be part of that cohort. And what it's done is change the responses that we're developing because we've got the evidence to truly support what the problem is. So I think, that to me is such a critical part of the work that we're doing, not just us understanding the problem, but providing communities with the information they need to be informed decision makers in solution design.
Yeah, absolutely. And no doubt, there'd be technology that plays a role in getting access to that information and I guess crunching the data, but also then providing those insights and information to those communities as you outlined too. And then when it comes to, say, accessing healthcare when people need it, I'm going to hazard a guess that there being and you've already alluded to, that in it being a region that is quite vast, there are going to be parts where it's not as easy to access traditional models of care. I'd love to learn about any examples of implementations of different models of care, probably powered by technology that or underpinned by technology that have been implemented in the region.
Sure. Look, we are a big fan of using technology and virtual care where we can to support access. So, certainly there have been some interesting things that we've been trying lately to just understand really the amenity of people and their willingness to uptake some of these. So, right now we have a pilot of obviously the Health Direct 1-800 virtual care model in our region, which has been really successful to a point. But, I think, again, it's about getting community on board with those things. It's been a fantastic opportunity in the disasters and things we had. The Commonwealth supported us with making virtual care available 24/7 to anyone who lives in a disaster-affected region. And, we see this massive uptake in people accessing that when there's a disaster because GPs are closed and those sort of things. I think what we also see is that after the disaster, some of that falls away. So, it's not that the technology isn't there and it's not available. It's how we maintain the momentum of people using those sort of services as an access point. We also use Health Direct for our mental health intake line as well. So we developed a solution with them around, where consumers and GPs and any other clinicians, but consumers also can ring that mental health intake line and have a complete assessment. And obviously we've built out the National Health Service Directory for our region so that we're really appropriately streamlining people to the care that they need, because, in mental health, we sort of assert that a default should not be that you see a psychologist every time you ring with psychological distress. There are so many other factors that influence psychological distress, and what we want to do is direct people to to the appropriate care the first time. So if it's financial distress that's causing the issue, we want to make sure that within our referral database, we actually are sending people to those sort of services rather than sending someone to a psychologist who can help with that, but is not addressing the crux of the problem. So I think that's been a big piece of work that we've really built out, really trying to diversify the opportunities for referrals in particular. And what that means is that more people can get more service because we're appropriately using the skills of the right referral base on the ground to address the issues.
Well, that ties back to your point earlier at looking at all of the UN Sustainable Development Goals that you mentioned earlier, and ties in as well with the homelessness piece too. Is that the Phases project that you were talking about earlier?
No, the Phases project, another technology project, not related to the sustainable. Well, not everything's related, but yes, Phases. Look, is again, our hope is that instead of, making health more and more efficient, another way to tackle this problem is to reduce the demand, right? And so how do we keep people well so they actually don't need to seek health services? So Phases is a really exciting project that we're leading on a Queensland basis. It's co-funded by the Commonwealth and the Queensland State Government. But really using technology that is sitting on the GP desktop. So from a PHM point of view, the data extraction tool we use across our region is a product called Primary Sense, which was actually developed within the PHN network. But it has a risk assessment tool on it. And I think the really interesting thing about it is it sits on the desktop and it has the ability to prompt GPs at the point of care if there are opportunities to optimise their treatment. So particularly the Phases project, which is preventing heart attacks and strokes through surveillance. We're focusing on the risk factors for high-risk cardiac patients. And what we actually know through all the data is only about 20% of high-risk cardiac patients are actually treated optimally through their high cholesterol management, high blood pressure management, those sort of things. And so we did some economic modelling around that. And what we demonstrated to both those governments is that if we only increased that optimal management in another 20% of patients, it really had the opportunity to save billions of dollars over the next 5 years by reducing emergency department presentations for chest pain, hospital admissions for heart disease, those sort of things, by managing high-risk patients better. And so for the implementation of that, we again have another independent evaluation partner working with us on that. But the whole idea is how do we prompt GPs at the point of care to make sure that they're optimally managing those patients and recognising the reduction of health system usage that goes with keeping people healthy. So, what we didn't include in that modelling is the economic benefit of someone still working and still being productive rather than actually, having a diagnosis that needs to be, that could lead to disability years for them. So I think that's really exciting because what we're trying to do with that is recognise the role of primary care in absolutely that upstream preventative and wellness model that we think primary care should play.
Yeah. Look, Julie, we've covered a breadth of topics that all tie in with healthcare, and I like that that's the approach that you've taken in the region as well, because as you alluded to, healthcare is not just about treating people when they're sick. There's the whole preventative piece, but there's all the other social factors that come into play too, and the environmental piece around disaster recovery and the preparedness required there. And for example, I can only imagine in a natural disaster, likely that has potential to not just impact physical access via roads and things, but also if you don't have power or the internet, that's going to make it tricky to access any kind of online service that you set up as a model of care. So given the breadth of the challenge, and there's a lot of moving parts there, if you were someone that wasn't kind of strategically minded towards a particular goal, that could feel like an awfully frazzled and a roundabout kind of role to be in. But what's that ultimate kind of guiding star for you in terms of in all of those different moving parts with a very diverse region that and multiple projects going on? In the end, what's the purpose? What's the drive that is consistent across the region for CCQ?
I think that's a really good question, and I know lots of people feel the same way about the diversity and the complexity, and the reality is this is a complex system we work in, and I think that's part of the problem in the way that we deal with some of it at the moment, because everyone likes to go, well, actually, this is the piece of the pie that I need to fix, and I know what I need to do, and I'm going to stay in my lane, and I'm going to get that done. But the reality is that, in my opinion, until you actually recognise the complexity, you've lost the point of the way you need to work, because, every time you change something in this system, something else changes. And so, and that's why for us, I think we keep community at the centre of what we do, because, if we had all the money in the world, we would do everything. And we would solve all the problems. But the reality is we don't have all the money. We need to be judicious with the resources we have. And I think community play a really strong role in deciding the things that they believe will create the best benefit for community. So I think community is definitely at the heart of it. And then I think being innovative about the way we implement that funding that we have to try and drive efficient models of care and models that increase access, and models that actually also recognise the social determinants in delivering that. So I don't know whether I have a simple answer for that question, and I don't think it is a simple answer, but I think the more we become used to living with that complexity and understanding the roles that others play, in all of the work we're doing at the moment, the disaster response work is a really obvious one where, we're facilitating that with community, but councils are involved and private industry is involved and all those sorts of people are involved. And the more people that are involved, the more solution providers you have at the table. And so what you find is that you start to leverage an ecosystem of solution providers to bring much more to the table than when you try and solve it alone. And so I think avoiding the complexity is actually detrimental to the change and improvement that we need. And, I think it's really interesting from a technology space then, because you start to go, well, if it actually takes a village, a community or whatever to do this, from a technology perspective in healthcare, we rarely develop solutions that bridge the gap between all of those providers. And so, the homelessness one is a great example, because we have providers from housing services, from community services, from domestic violence services, all those things contributing to the one data platform about how they work together. And suddenly, what opens up as the appropriate path forward changes. And so I think from a technology perspective, us bringing all of those other sectors on a journey with us is really important.
That highlight, I feel like that's a great summary for the conversation, and provides that succinctly, because as you say, with the diversity brings challenges. By leaning into that with all those stakeholders, but hopefully being able to have that not centralized, but to be able to then, as those challenges collide, then potentially solutions come from it, and the cliche synergies do evolve based on the expertise and experience of others. But in the end, if it comes back to the most important being the individuals in the community that are providing that feedback either directly or through their actions, and listening to that, and also I feel like importantly that the point earlier that came up around the being action led, I think is super important, just by taking an approach of, well, let's not do this because we don't have all the information, or potentially there are risks. There are many, like, we need to factor in the risks of not doing anything at all, doing things as we're doing them right now. So, Julie, I've loved this conversation. I appreciate you making the time, and I'm sure we'll do it again at some point. All the details will be in the show notes of this episode, and some links and information for people to check out. Julie Sturgess, thank you so much for your time.
Thank you, Peter.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.